I thought I was doing great. Eating well, staying active, managing stress. I felt I was in control of my health until that fateful phone call from my doctor. Teresa, we need to talk. You are in serious trouble. In an instant, my life did an about-face. My mind was racing with questions. How? Why? I felt fine. But the truth is, something has been silently working against me for a very long time, and I didn't even know it. It was literally taking my breath away. I mean, I knew I was fatigued, but isn't everyone? Turns out I had severe hypoxia. My body just wasn't getting enough oxygen. What if I told you that you may not just be fatigued, but you may be suffocating from the inside out? Oxygen is life. You can live weeks without food, days without water, but only minutes without oxygen. This condition called hypoxia is way more common than you might think, and it can deprive our bodies of this essential element, oxygen, without any warning. So what exactly is it? According to a study by the NIH called hypoxia, hypoxia occurs when oxygen is insufficient at the tissue level to maintain adequate homeostasis or perfect balance. But here's the catch. Sometimes the symptoms are so subtle that you may not notice them, and you might write them off as fatigue or stress or just having an off day. But who's at risk? If you're someone that spends time at high altitudes like pilots, frequent flyers, or skiers, you could be affected. People with respiratory conditions, sleep apnea, or those recovering from anesthesia should also be mindful. And honestly, it can impact everyday folks, just like you and me. If you're dealing with poor air circulation, if you're around environmental toxins, or you have bad posture, or you might have health issues you don't even know about yet. The real danger is when people don't recognize the symptoms until it's too late, like me. And sometimes time is the difference between life and death. So how do you recognize hypoxia before it robs you of your health? At first, the signs can be pretty subtle. Maybe you feel a little lightheaded, or dizzy, or you suddenly get a headache. You might even notice that you're out of breath even when you're just sitting there doing nothing. Or maybe your brain feels foggy. You feel confused, or just straight up nauseous. Sometimes it just feels like you're way more tired than usual. But if things get worse, that's when it gets serious. We're talking blue lips, blue fingertips, extreme fatigue, trouble coordinating even simple movements, and in really bad cases, passing out. If something feels wrong, don't ignore it. Your body's talking, so listen. What should you do if you suspect hypoxia? First off, breathe. Stand up straight. Get fresh air. Go to a lower altitude if possible. Use supplemental oxygen if it's available. And if symptoms persist, get medical attention immediately. But before you find yourself in my situation, there are some very simple things that you can do to keep your oxygen levels up. And we're talking very simple, folks, like remembering to take deep breaths throughout the day. Sounds easy, right? Well, it is, but most people forget. Good posture is another one. Your body cannot get enough oxygen for your lungs to expand if you're all hunched over. So sit up straight, stand up straight. Your lungs will thank you. And don't ever underestimate the power of a good night's sleep. Your body does so much healing while you're sleeping, and if you are not sleeping well, you're not oxygenating well either. Of course, moving that body and getting exercise of any kind gets the oxygen flowing. And last, but definitely not least, stay hydrated. Your blood cannot carry oxygen efficiently if you are all dried up. Now, these are very small habits, people, but trust me, they make a big difference. And you want to start now rather than later, because hypoxia is not just some rare medical condition. It can strike at any time, to anyone, anywhere. I certainly never thought that hypoxia was going to affect me, and I definitely didn't think that I was going to get a phone call that would change my life. But now I know the truth, and so do you. So if you feel off, do not ignore it. Listen to your body, ask the right questions, and take action before it's too late. The choice is yours. Will you take your next breath differently, knowing that oxygen is the key to a longer, healthier, more vibrant life? The answer is in the air around you. Awareness can save lives, maybe even your own. And you can start right now. Let's all take a deep breath in unison. Thank you.